It is a medical condition that may affect your life and almost certainly touches the life of someone you know and care for. In fact, the American Lung Association says asthma affects 34 million Americans, and nearly 1/3 of those are children. The condition accounts for 13 million missed school days every year in this country, yet asthma has no cure. Instead, it's all about keeping it under control. But now asthma sufferers can breathe a little easier knowing there is a new and more accurate way to help doctors treat this condition. Joining us this morning to tell us all about it is Dr. Jackie Aguirre-Sabet from Family Allergy and Asthma Care Clinic near Washington, D.C. Dr. Aguirre, thanks for being here. Good to see you this morning.
Thank you for having me.
It just struck me that I'm sure if you ask someone, what is asthma, they'll have a general understanding, oh, it's when you can't breathe. But let's be a little more specific here. What is asthma?
So there are two components to it. One, which is the squeezing of the muscle on the outside of the lung, and that causes that cough and sometimes that wheeze. But what's happening on the inside is really more important. The inside of the lung gets all swollen and inflamed, and that's the chronic ongoing part that makes you a setup for an asthma attack.
You know, if you or your child has asthma, I'm sure it's a very difficult condition to deal with because of the suffering, and I'm sure you see a lot of that in your office. Describe the typical asthmatic, some of the challenges they face.
Their number one challenge is they come in with the cough and the wheeze and they have no idea that they even have asthma. They've been told that it may be wheezy bronchitis. They've been told a lot of other diseases, but not this scarlet letter A that it's asthma. So that's the first challenge. Once we get them past that, then it's how do you treat this, how do you properly diagnose this, and how do you live a very healthy life with asthma.
Well, you're here to tell us about a new treatment system, and I think it's really interesting because it can really help the doctors test for inflammation, which is something that's very important in terms of knowing that you even have asthma at all. Tell me about it.
So that would be this, which is the Niox-Mino, and what that does is actually look at the inflammation, which the reason that's so important is because it is the reason you have asthma, and it's the most important thing we need to treat in the asthma is the inflammation, and this machine will allow you to do that.
How do you use something like this in your office?
So we use it in a number of ways. One is because I do see so many children, because it's such a common disease in kids, is that it's an easy machine for them to use. They pick it up, they blow into it, and within 2 minutes they'll actually get an answer. Another reason why we'll use it is to decide if it is asthma or not, because there is so much confusion. Is there inflammation that needs to be treated or isn't there? And this nice machine will tell us that.
Well, you were mentioning, and I want to mention this very briefly, we were talking a little bit off camera about the fact that before you used to have to go down the throat. It was very painful, and especially if you're dealing with a small child.
Right.
Can you imagine?
If you really wanted to find the answer, you could do this very invasive procedure, which really wasn't practical. But another thing many people will do in their office is a common pulmonary function test. It doesn't give you actually as accurate as information as you can get from this that is truly repeatable, and it's so much easier to use.
Tell me about the results. What are you seeing?
So what I see is that the patients love it, and the reason the patients love it is because they can end up on just the right amount of medication. It sort of is a Goldilocks formula. You never want to keep somebody on too much medicine or not enough medicine. And the Niox-Mino will actually allow you to see, is your asthma doing well? Let me bring you down off some of this medication.
Nice.
Oh, your asthma isn't doing well. You're at risk of an attack. Let me actually give you some more medication.
So, doctor, is this a standard test that doctors will offer patients who come in for asthma testing?
At this point, patients are going to need to ask for that. And many doctors may not know that recently the American Thoracic Society has encouraged the measurement of exhaled nitric oxide through a machine like the Niox-Mino, which is the only machine that's made and available in the United States for this kind of a measurement. Patients can ask doctors to go to the website, or they can watch this YouTube video to find more information out about it.
And so, with just about 30 seconds or so left, what is the takeaway? What do you want viewers to know?
That asthma is a serious disease, that children, of course, miss school. That means parents miss work. Sadly, people die from asthma. None of that needs to happen if there's correct diagnosis and then correct treatment. And a measurement like exhaled nitric oxide with the Niox-Mino will make that a much easier disease to conquer and live with in a healthy, happy way.
And that is really basically what we all want. So thank you so much for coming by and sharing this useful information with us this morning.
Thank you.
Good to see you. And for more information, you can visit the website nioxmino.com or go to aerocrine.com.